mentioning other key populations, target groups, and it was very kind of like religiously influenced. Also in the media, we had a kind of like stigmatizing representation of people living with HIV. There was often a representation of what we call the alone viola, which it's basically like a purple shadow represented on people living with HIV. So in the media. After 30 years, where are we? And that's a good question, because some progress has been done, but we still like continue to see a lot of like socio-cultural stigma, but also internal stigma. So when it comes to like a recent survey that has been published, we see that 60% of people living with HIV will never disclose their status because they think they will have like, professional or personal repercussions. Thank you. Some people would not living with HIV will never sit close by to a person living with HIV or not even drink from the same glass. So this kind of like raises the question, are we still like progressing, or are we living like Donakatin kind of like era? So in terms of like health system, and in Italy we have a kind of like complex health system, because even if we have like national plans and all of that, we have autonomous regional kind of like entities, and we see, based on like different reports and also from community-led monitoring, that there's like healthcare disparities in terms of like healthcare access in different regions, meaning if you have more resources, if you have more money, you can actually spend this money on health promotion and prevention campaigns. The National HIV Plan, the last one was from 2017. Some time has passed by, but we see not a lot of implementation when it comes to the kind of like key points. Sexual education in Italy is not mandatory, and also free contraception is available only in few regions, and the U equals U concept was only approved kind of like by the government in 2019. So this is kind of like to give you a sense of like, healthcare inequities, healthcare kind of like disparities when it comes to the Italian context, and also going specifically into like HIV testing. We know that it's, so HIV tests are free only with exemption codes or with like within infectious diseases departments, but many times family doctors don't know about it. Other STIs also might not be available in terms of like reimbursability, and there's also a limited availability of community-based HIV testing centers. We've been talking about like the demedicalization of like prevention, and we know we have here Sandro Mattioli, the president and founder of the Bologna checkpoint, and these are spaces that are like more accessible to the populations we work with, and also provide services in a more kind of like safe manner. HIV tests can only be administered by healthcare providers and approved by and some HIV approved association. So data is like an issue in Italy, because the data we have is either insufficient or not accurate. So the annual number of tests performed is not there. So we know maybe like we have some incidence studies. There's but still like a lot of data is missing. We don't have like segmentation of, for example, the migrant population. We in this bullet point, migrants are jointly called foreigners. We don't know where are these people coming from. Do they have the documents to actually get the public healthcare system? Do they have a permit to reside? Do they have legal documents or not? How are they finding these services? And all of these questions kind of like, are still related to what we said before. There's no specific data available for trans, non-binary, and sex workers. And also available data that we have, so the focus on like the kind of like heterosexual and MSM community doesn't necessarily translate in effective implementation when it comes to funding priorities and the projects that we would like to see. So what has Plus, and again thanks Sandro for being here, what has Plus been doing to respond to every HIV prevention innovation in the past few years? So in 2013 and 2015, Plus kind of like sent the first survey on PrEP interest within the Italian community. That was after the FDA approval of PrEP. In 2017, it launched the first online PrEP info campaign, giving kind of like information on the prevention, testing centers, and that was all after the European Medical Agency approved PrEP in Europe. And lastly, actually not lastly, there's a lot of things happening and that have been happening, but some of that we wanted to mention, it was the opening the first community-based PrEP point in Italy with Sandro in Bologna, and another one in 2023 in Rome after the generic approval of PrEP. In 2020, we formed actually Marco Stizioli, the person opening up the presentation, kind of like co-founded PrEP in Italia, collective again under Plus, to kind of like start to raise awareness on PrEP and like information on like sexual health and well-being, as my colleague does mention before. So it was like to support PrEP users, but also address the stigma present about PrEP within the LGBTQI+ community first, but then also to the broader population. So this is like information about PrEP to protect yourself from HIV and for like serene and kind of like chill sexuality. So as we saw before, like, you know, different PrEP campaigns, we also need to understand that when we do like campaigns, when we design campaigns, we also need to understand the sociocultural, religious, and political context of the country. In Italy, certain campaigns that are very explicit, because of the background that I showed before, are just like not suitable. So our way of kind of like promoting PrEP has been through a kind of like more health kind of like direction. It wasn't about like explicitly talking about like sex. Yes, we have, you know, experiences on the website, testimonials. We have a conversation about PrEP, but it's more kind of like neutral and using like neutral language. PrEP and Plus have also engaged in multi-channel dissemination, information and online peer counseling. The kind of like why multi-channel? Because again, when we think of like PrEP awareness, what channels are people actually using and how do we use these channels to reach the specific populations? This was also the first time that in 2020, since the opening, we actually were able to form a community of both PrEP users but also potential PrEP users. And when, like, for example, in the Telegram group, you have people coming from more rural or like southern regions, and they can actually find the information they need, and they can, you know, like also share concerns, because we're humans, and of course we constantly deal with like ignorance and stigma, but it's okay to ask for questions and find people that can answer based on their personal experiences. So, yeah, and like also, of course, Instagram, Facebook, of course, it's different targets. When we talk about like Instagram, of course, Gen Z, millennials, maybe more, you know, like available to use those platforms. When it comes to Telegram, you know, like sometimes people, like especially within the MSM community, use Telegram also to find or chat with like sexual partners. And when we saw like that we opened the Telegram, you know, people sometimes ask for health information, sometimes they share nudes, and that's okay. Like, you know, like we're talking about, of course, like in the end, like sex and sexuality and well-being. And it's kind of like a way to kind of like merge health promotion, but also contextualized. There's been different events in these past few years with Plus and PrEP in Italia. Last year, we actually ended up publishing a book called Si ero coinvolto, The Sexual Revolution Restarts from HIV, which was an autoethnography and collective writing process where specifically marginalized identity within the HIV landscape were shown. So we had people like women on PrEP. We have women that were born, cisgender women that were born with HIV and shared their stories. We have younger people. So it was kind of like an autoethnography and collective writing from collective organizations. It's also, we did a PrEP camp last year, and it was basically providing capacity building to PrEP users, and that in the end kind of like to form them and be PrEP ambassadors in their communities. And we saw, and especially like in this recruitment process, we kind of like made it even for everyone. Anyone could apply, and we actually had representation of also cisgender women that, as we know, as we have from like community-led monitoring data, cisgender women are actually few, like the smallest number on PrEP in Italy. It's mostly MSM and trans women. And it's also my duty to mention Giulio Maria Corbelli, which I didn't have the pleasure to meet in person, but he opened the roads when it comes to HIV prevention and PrEP in Italy. So in such space, talking about the Italian context, we also have to kind of like bring the legacy back. And another thing, we talked about data, and data is missing. So community-led monitoring is a way to gather data, like whether it's interest of people for CAB-LA, whether it's DoxyPEP interest. We kind of like want to understand what are people wanting, and are these services reaching to the people they need. And so the annual demographics on PrEP in 2022 kind of like showcased what were the gender, territorial, and like geographic barriers of people. In May 2023, free PrEP was finally approved in Italy and reimbursed. And in December 2023, the first official online campaign was launched by all HIV associations. This means the measure PrEP, the measure of tranquility. Again, like you have to know the target when you make a campaign, and I think this campaign was kind of like playing, because it was like published on different platforms. Like it was more about like you can have a chill, relaxed sexuality and be calm about it, and it was less more about like just like more, as we mentioned before, like knowing the target, knowing where you're publishing the things is important. So this was more on like being serene. So there's still so much to be done. We have some like improvements from like few users in 2019. We have now over 11,000 people from 22 PrEP prescribing centers. In 2019 we have now 80. And some of the questions that are in our heads right now is like, yes, we're doing this community-led monitoring about CAB-LA and like the interest, but are we actually ready to implement that? We said that CAB-LA will require visits every 2 months instead of 3, and we have like overbooked agendas of health practitioners. We have a lot of like issues when it comes to email and online coordination. So are we actually, and we like CAB-LA would also require storage and training for healthcare providers. So when we think of like, okay, CAB-LA, cool thing, we know that 68% of the people surveyed in the last survey actually want CAB-LA, but do we have the services? Do we have the actual like setup? Other challenges like Italian guidelines have to be aligned with WHO guidelines. We still have cisgender women kind of like recommendation of taking PrEP for 21 days when we know it's like 7 days or less even before the first sex encounter. And then free PrEP can only be prescribed by infectious diseases clinics. Bureaucratic and economic challenges, as I mentioned, like still like do we know if overbooking, online counseling, actually like there's a lot of like also territorial barriers when it comes to the north-south disparity, healthcare mobility. So there's a lot of issues that we need to tackle, and thinking also how do we as a community kind of like promote health and healthcare access and PrEP and like well-being and sexuality, even when in contexts where, you know, funding is limited. And many times I wanted to mention most of the campaigns that we did, thanks to when it comes to PrEP in Italia, Marco Stizioli and also Sandro, many of them weren't funded. So like, do we actually have the resources also from the community to bring out change? And lastly, free PrEP also means free STI tests, and there's still underrepresentation of women and other key populations in the HIV prevention landscape in Italy, and we need to kind of like change this. We believe in healthcare access for everyone. We believe in you know, safe sex, tranquility sex, as we mentioned before, but when we say everyone, it means everyone and not only certain populations. So thank you.